Yeah, the arrival itself hasn't changed too much, like where I park or things like that. But as you get in the hospital, you guys will notice things have changed a little bit here. I don't know if it's scary coming to work, but it's definitely scarier being at work. This is a medical surgical unit, and so, for example, a COVID patient who was at home and they became more short of breath, and they needed some supplementary oxygen, and we were afraid of decompensation with them, would be cared for on a unit like this. So here, coming up, and we're going to see a 76-year-old patient who was on our team for about 3 or 4 days in the medical surgical unit before she unfortunately decompensated and had to go to the intensive care unit. Luckily, she fought her way through the intensive care unit and made her way back out and is doing well now. Good morning. Hey, you. How you feeling this morning? We've been working at getting the lines and tubes off of you, and so we've done okay. You're really a success story, and you know, you should feel good about things. Okay? She looks appropriately exhausted. But she's getting better, and we continue to work on what I call shedding ICU jewelry, lines and tubes and things like that. No, I wouldn't say immediately. You know, I think a couple weeks after that second dose, I'm going to feel much more confident. But I think as far as I've read, it's going to take some time after the second dose until we can have real confidence in it. It's strangely one of the big things that wears on you is to put this on and to be cognizant of how you're doing it over and over and over again. So this was one of our success stories, and there are a lot of patients that take what we call the COVID dive and decompensate. You know, patients that run 2 liters all of a sudden go south and need a higher level of care. But this patient's heading home today, and she's excited to head home, and we're excited for her.